Okay, how's it going? This is Max Wettstein with Destination Health Plus, coming to you from Encinitas. Right here next to me is Lisa Ford. She has her master's in physical therapy, and I wanted to speak with her today and have her talk to you about low back pain, what causes it, what you can do to maybe prevent it, how to align your body and maintain a neutral spine and move correctly so you avoid the back pain or any injury in the first place. So Lisa, we were talking and I noticed you kept going to neutral spine and you kept talking about alignment. What do you mean by alignment? Are you talking about muscles or the spine itself, leg length difference? First you got to get yourself aligned properly, is that correct?
Yes, alignment can mean a lot of things. Neutral spine, is very specific alignment, meaning when your spine's not in too much lordosis or it's not too flat either, which is more of a kyphotic. So you want your spine in a position where you just have a slight curve. And for some of us that's easy to find, and for some of us it's not, because our muscles are tight or our spine is very stiff, and so we more naturally have an increased lumbar lordosis, or we're very flat in our low back, and that could be for different reasons, either something you were born with or just because of muscular imbalances in the system or tightening, stiffening of the spine. So if you don't have any significant spine problems, it's not that hard to find your neutral spine, and that's the position you want to stand in. That's the position you certainly want to lift in and do your daily activities sitting, because that is where your center of gravity is the best and all the weight goes through your spine instead of evenly through your spine and into some muscles more than others. So very specifically though, we always talk about neutral spine for lifting. That's probably the time where you can really injure yourself if you're not using a neutral spine. Right,
you always hear about guys in the gym maybe putting a little bit too much weight on the squat rack or the deadlift, and next thing you know they've tweaked something because they let their lower back sort of round out, and now all of a sudden their spine is not in that nice neutral position with the lordotic curve that you keep talking about, or that nice C curve. And so
a slight curve, yeah, you don't want it to be, there's a balance there. But you're right, that's where you're probably going to get injured, when you're not in that neutral spine, because that's where you're strongest, and that is where, that's the position where you can kick in your stomach muscles and your back muscles to protect the spine. If I am too lordotic, then my back muscles are working, but my stomach muscles really can't. They're on stretch. And the same thing goes if you have a really flattened low back. You may be able to kick in some of your stomach muscles, but your back muscles aren't working in conjunction with the stomach muscles. So it's when they can contract together that you're protecting your spine with your muscles, and you're also distributing the weight evenly through your spine.
So you want to keep the spine in its ideal position no matter what type of movement you're doing, but now you're saying you also want to engage the core, and the core is your low back muscles, your abdominal muscles. Keep those engaged throughout the exercise as well?
Yes.
How you don't really lift with your spine exactly. You lift with your hips, legs, and your butt muscles. Is that correct? Or
right. So our back muscles, the paraspinals, they're really meant to hold you up for long periods of time. So they do the work of like an endurance athlete. They can go and go and go, but they're not meant to do any heavy duty work. Whereas your quads and your butt muscles, your gluteus muscles, they are meant to do the heavy lifting, and they're more like a sprinter. So if you're going to bend over and put your spine out of a neutral position, and then as you come back up, you're using your back muscles. And that's not what they're meant to do. They're not meant to do that kind of activity with heavy loads, and they're not meant to do it repetitively. So when you're in a neutral spine position, and then obviously if you're going to be lifting something heavy, you contract your abs and your back muscles. You're going to bend at your hips and your knees, and all the lifting is done by the glutes and the quads, not through the movement of the spine. And that's how you're going to injure yourself. I mean, it's such a common injury, whether it's just because you picked up the pencil off the floor, but you've done it 100,000 times before and finally it caught up with you, or if it's because you lifted something really heavily improperly. And then adding to that, what makes it even worse is if you bend over and you twist at the same time. Just like getting your luggage at the airport or something, pulling it off and then twisting to set it down, that is such a common injury.
Kind of a compound movement. And when you talk about injury, is it like a spasm or a strain? Or
yeah, it could be anything from a spasm to a disc bulge to, a complete tear. Sometimes, maybe one vertebra or a couple vertebrae get out of alignment, and then that can create a muscle spasm as well. So, of course, you always hear of the disc problems, and that certainly is a big problem in that, but there can be other things too, just something going out of alignment or muscle spasms. So that neutral spine is so important, and then everybody will say, okay, you need to contract your abs, contract your back muscles, and that strong abs helps protect your back. And that's true, but not...
They're both part of your core. They make up your core.
Right. But I think where some people get a misconception is that they... they're going for the six-pack abs because they look good. And the rectus abdominis is probably, as far as protecting your spine, probably one of the least needed muscles. So everybody's doing their crunches, and yeah, that's going to make you look good, but that is not how you're going to strengthen the muscles that need to support your spine. And so it's more through actual neutral spine exercises, which you'll see a lot of that in Pilates.
What about yoga?
No, I wouldn't say, no,
Okay.
I wouldn't say so much yoga, because we're talking about specific strengthening. And I sometimes in yoga, yes, you get some of those movements in yoga, like a plank position, which is also a Pilates thing too. And the physical therapists are very, that's one of the big things we do is you get somebody in a neutral spine, and sometimes that's hard for people to get into the neutral spine or to maintain a neutral spine because they're not used to it. And then you strengthen your stomach muscles in the neutral spine. Abdominis, and then your obliques. Those are the ones that really kind of create a corset. And then they work together in conjunction with your back muscles, and they create a corset that protects your spine. And those are the ones you want to work, and you want to work them in a neutral spine position. Get your spine into a neutral position, and then I contract my tummy muscles and my back muscles so you contract at the same time. And if I just hold it here...
Pull your belly button to your spine.
Yeah. Finding that neutral spine, which somewhere between... this certainly isn't too much room here. You don't want to be totally flat either. It's just a slight curve, very slight curve, and then you contract the same kind of thing where you're pulling your belly button up and in. And at the same time, you should feel your back muscles contract. And you're really feeling for the contraction on the side here, not the feeling for this corset. And you start with holding it, and then you add activity to it. Can I control my muscles and keep them tight while I move my leg? Can I keep that neutral spine? Or do I lose that neutral spine? Does my back start to arch because my muscles aren't weak enough?
Are you happy? You're not happy.